Assalamualaikum viewers and welcome back to my channel Biodenverse Hub. Today in the playlist of oral and maxillofacial surgery, we will be continuing the same Impaction series. In that regard, our today's video will be about the indication and contraindication for impaction. So first of all, let us discuss the indication for the removal of impacted teeth. We need to prevent the periodontal disease progression. That is basically, in the case of impacted third molars, there are high chances of the periodontal involvement of the maxillary or mandibular second molars. So we need to save the second molars from the periodontal disease progression. In that regard, the impacted third molar, which is for example the mandibular, there is a decreased amount of bone distal to the second molar, and due to which there is gingival inflammation, which leads to the apical migration of the gingival pocket, that leads to the gingivitis and then to the periodontitis. The periodontal problems from the impacted maxillary third molar is even more serious because it involves the distal furcation of the maxillary second molar. Hence, the early removal, it is indicated, that will lead to rapid bone healing and bone filling in that area. So we need to save the adjacent second molar from the periodontal involvement. Second indication is the prevention of dental caries. The dental caries that are caused by the bacteria to the impacted or partially impacted third molars can be exposed, and they can also involve to the distal aspect of the second molar. Even if the no visible communication exists, it can still progress, it can still involve the distal aspect of the second molar, and it will usually leads to the periodontal involvement and also the dental caries of the adjacent second molar. Now, third most common indication for the removal of impacted tooth is the prevention of pericoronitis. So we will be discussing in a bit detail about the pericoronitis in this video. So first of all, let us discuss what is basically the pericoronitis. It is the infection of the soft tissue around the crown of the partially impacted tooth, usually caused by the normal oral flora. What are the risk factors? It is most common in the immunocompromised individual, in the influenza or upper respiratory tract infection, or the patients that are on the immunosuppressive drugs. It can also occur in the patient with intact host defenses. So now we will be discussing the etiology of the pericoronitis. First of all, entrapment of the food under the operculum during the eating, it can occur, which will lead to the bacterial colonization, as that area is very difficult to clean. So it will definitely cause the bacterial colonization out there, which will lead to the pericoronitis, that is the inflammation of soft tissue around it. In that regard, the streptococci and other anaerobic bacterial flora of the gingival sulcus, they are most probable to cause the pericoronitis. Secondly, there could also be the trauma from the opposing maxillary third molar on the lower impacted or partially erupted mandibular third molar. That traumatized the soft tissue, that is basically the operculum covering the partially erupted mandibular molar, which becomes swollen and leads to the pericoronitis. So these were the two common etiological aspects. And pericoronitis, it is most commonly seen in the vertical impaction or the mesioangular impaction. Now we will be discussing some important clinical features of the pericoronitis. First of all, the patient will experience intense pain radiating towards the ear and the temple area or even to the throat. Secondly, there will be halitosis due to the food lodgement that occur under the operculum. Patient will also experience trismus or limited mouth opening because there are usually attachment of the muscles of masticatory system. The patient may have the fever 101 degree Fahrenheit, malaise and facial swelling. Now, extraction is to be avoided during the active infection, that is the pericoronitis. It is due to that it can usually cause the following condition: dry socket, the post-operative infection, the slower healing capacity, and more bleeding. So due to these reasons, they are usually advised to avoid the extraction during the active infection. Now we will be studying some important complications that can result as a result of the pericoronitis. First of all, the infection can spread to involve the facial spaces of the mandibular region and lateral neck region. It can also cause Ludwig's angina, that is the involvement of the submandibular, sublingual and submental spaces bilaterally, and it can also cause the pericoronal or peritonsillar abscess. So these were some important complications that can result as a result of the pericoronitis. Now we will be discussing the management protocol for the pericoronitis or the impaction that has been occurring. So first of all, you need to look for the angulation. If it is the horizontal or mesoangular, you need to extract that tooth. If it is vertical, then you need to check out the age of it. If it is greater than 25 years, you need to remove that impacted tooth that is vertical in orientation. But if the age it is less than 25 years, then you need to go further on to judge the type of infection. First of all, if it is a soft tissue type of infection, you need to categorize it into the mild, moderate or severe. If in case of mild, you need to check on for the episodes. If it is the first episode, you need to irrigate it with the H2O2 or saline, or need to perform the operculectomy and wait for the possible eruption. If there is the multiple episodes, you need to extract that tooth. Now, if under the moderate category patient it has the first appointment, there is a need for local irrigation and extraction of the maxillary third molar, opposing that mandibular third molar. Then at the second appointment, you need to extract the mandibular third molar. Now, if it comes under the severe category, you need to go for the parenteral antibiotics, and after that, after the infection gets resolved, you need to go for the extraction. Now, if the impaction type it is a hard tissue one, you need to again categorize it according to the Pell and Gregory's class A or 1. If the case is of the class A and 1, you need to go for the maxillary third molar. If it is present, you need to check out for the intensity. Again, if it is mild, go for the local irrigation and wait for the possible eruption. But if it is moderate to severe, you need to go for the extraction. In the same case, if the Pels and Gregory class A and class 1, if the maxillary third molar it is absent, then you need to go for the extraction of the mandibular third molar. Now, if according to the Pels and Gregory it is the class B and class 2, so you need to go for the extraction of that tooth. So this was all about the pericoronitis. Now we will be discussing the indication continued that we have been studied 3 important indications. The fourth one is the prevention of root resorption. We need to extract that impacted tooth in order to prevent the root resorption of the adjacent tooth. The fifth important indication is the impacted teeth under a dental prosthesis. Sixth, prevention of the odontogenic cyst and tumors, because if the follicular space around the tooth it is greater than 3 mm, then it is most common occurring that dentigerous cyst will form or it has been present out there. 7th, the treatment of the pain of the unexpected origin. 8th indication is the facilitation of orthodontic treatment. 9th indication is the optimal periodontal health in order to ensure the optimum periodontal health. The 10th indication is the prevention of the jaw fractures. And 11th is the before performing of any orthognathic surgeries, you need to remove the impacted tooth. We also have some indication for removal that is according to the NICE guidelines. First of all, according to him, episodes of the pericoronitis, if it is greater than 2 times, you need to go for the extraction. If the tooth it is grossly carious, if it is the untreatable pulpitis, or if there is presence of any associated pathologies, that is the tumor, cyst or carcinomas, or if there is any jaw surgeries, osteotomies that have to be performed, or any orthodontic requirement. So you need to go on for the extraction of tooth in these conditions. No prophylactic removal if asymptomatic. Now we will be studying some contraindications as well for the removal of impacted tooth. First of all, at the extreme age. As the patient aged, the bone became less flexible, less elastic and highly calcified. It also becomes less able to withstand the forces and pressure, and there are increased chances of the bone fracture and removal. Their response to surgery is also results in the increased swelling and increased discomfort and also slow healing. there is also less periodontal regenerative capacity. But in that case, in the case of extreme ages, you need to keep the patient on the follow-up for 1 to 2 years to check for any problem arises or any complicated sequelae to occur. In that regard, you will have to go for its removal. Second contraindication is the compromised medical status. If the patient has a compromised medical status, then definitely there is a contraindication for its removal. Third important contraindication is probable excessive damage to the adjacent structure. For example, if there is increased chances of damage to the nerve that is present in close proximity to that impacted tooth, or it could be the other teeth, or it could be the prosthesis in the older patient. In older patient also, there is severe periodontal defect on the second molar and on the distal aspect. So in that case, there is also a contraindication for the removal of third molar because it will result in the second molar that will usually get lost due to it. In the younger patient, you remove the tooth while taking the special measure to preserve that tooth as well. So we have studied the two cases out there. That was the involvement of the second molar. In the older patient, there is no chance of its removal because its removal will lead to the loss of the second molar as well. But in the younger patient, you could remove it by taking the special measure to preserve the remaining tooth. So these were some contraindications. We will be studying the classification for the impaction of mandibular third molar in the next video. I hope this video will be helpful for you all. Don't forget to subscribe to my channel and also click on the bell icon so you will get notified about our future videos and updates. Thank you.